Shortness of breath during physical activity, occasional stabbing or aching pain in the heart, swelling in the legs by evening. When should you rush to see a cardiologist and get checked? And when might these symptoms not be related to the heart? My name is Marina Shestakova. I am a cardiologist, dietitian, and nutritionist. And today we're going to talk about 6 warning signs that may be related to the heart, or they may not be related to heart problems at all. As I describe different symptoms, I'll explain when they're more likely to be heart related and when they might be something else. All right, let's get started. The heart is actually a vital organ, and if it stops, a person dies. It works throughout our entire lives, 24 hours a day, 7 days a week without any breaks. The heart only rests during the pause period, that is, between contractions. Relaxation, this is the period of relaxation. That's the only time it rests. And if its resources are depleted more quickly, for example, when we have hypertension, high blood pressure, when there are plaques in the vessels, meaning impaired blood flow to the heart, when it lacks vitamins, or when we overload it with excessive stress or too much physical exertion, then it really does become exhausted. But sometimes certain symptoms that seem to us to be related to the heart, like heart pain or stabbing sensations, are actually far from it and are connected to something else entirely. For example, with the nervous system. So, what warning signs can there be, and what might they mean? Shortness of breath during physical activity. For example, you walk up 1 or 2 flights of stairs and experience shortness of breath, a lack of air. Yes, this may be due to the presence of plaques in the heart, atherosclerosis of the heart's arteries, which leads to poorer blood supply. And even with minor physical exertion, the heart needs more blood, but more blood can't get through because the vessels are clogged. This could happen. But shortness of breath during physical activity can also be caused, for example, by anemia, especially if you are young, between 30 and 40 years old. Especially if you don't have any risk factors for cardiovascular diseases, then in this case, shortness of breath may be due to low iron levels in your blood and body. In this case, anemia develops, and the lack of oxygen is not due to clogged vessels, but rather to a low capacity for oxygen transport, low hemoglobin, ferritin, oxygen carrying capacity, and so on. If you experience shortness of breath during physical activity, you should definitely see a cardiologist. But in addition to that, we must also do a complete blood count and a blood test for ferritin to rule out anemia. This is especially important if you are a girl or a woman of reproductive age, especially if you have a history of pregnancy and childbirth, and especially if you have never taken iron supplements, and no one has ever even told you that you might need them. The next symptom is swelling of the legs and feet by the evening. Indeed, when the heart weakens, when heart failure develops, when the heart as a pump, as a muscular pump, can no longer cope with pumping blood, some of the blood can remain in the lower limbs, in the veins, and cause this swelling. Yes, this can really happen. However, swelling by the evening can also be related to varicose veins or lymphatic system insufficiency. Lymph is like a drainage system. These are also small vessels that run parallel to the veins. So, what is the difference here? What could be the distinguishing feature? Well, first of all, varicose veins can be seen visually. You can see the veins on the legs become enlarged, almost like clusters. These veins bulge out. In this case, it's clearly varicose veins. Swelling with varicose veins can occur, and often does. That is, varicose veins. It can be on one leg, but not on the other. With heart failure, when the problem is with the heart, both legs swell symmetrically and equally. It's not like one is more swollen and the other is less. With lymphedema, when lymphatic drainage is impaired, it's usually the same. As a rule, there will be asymmetry, meaning one side is more affected and the other side is less. And when it comes to swelling in the legs, if the swelling is caused by heart issues, it is usually accompanied by shortness of breath and other symptoms, problems with the heart. So it's not an isolated symptom where nothing else is present. That's why in this case, you'll understand that it's the heart. If one leg swells more than the other, or only one leg swells, then first and foremost, you should see a phlebologist, or initially a surgeon. Next, rapid fatigue, decreased endurance. So here, it's not so much about shortness of breath, but rather that you have no energy for anything, not even your usual household chores. And again, this can look very similar to anemia, because with anemia, it's the same thing. You wake up in the morning already feeling tired, even first thing in the morning. By the way, with heart problems, you might actually feel more or less okay in the morning. That is, you start to feel worse by midday or evening. For example, people with anemia are already tired in the morning. They can't wake up. They need a liter of coffee, some tonics, or energy drinks just to feel normal. And throughout the day, they feel extremely fatigued. For someone with heart problems, the fatigue builds up, meaning in the morning, the heart still has some reserve. There's still some energy, it's still working, but it gets tired a bit later. And again, I'll repeat, we always pay attention to the combination of symptoms. That is, usually it's never just one symptom. Irregular heartbeat, tingling in the heart palpitations, that's the whole story. Yes, indeed, this can be related to arrhythmia or impaired nerve conduction in the heart. If you have constant arrhythmia, then it's definitely the heart. Paroxysmal tachycardia, that is, fibrillation, atrial fibrillation, or persistent cases. Some kind of arrhythmias like these? Yes, that's the heart. But there can also be extrasystoles with heart palpitations. This can indeed be related to the heart itself, but arrhythmia can also occur due to stress. Very often, if you've been stressed, plus some kind of physical activity that's unusual for you, you may develop arrhythmia. If you rest for a couple of days, it will go away and everything will return to normal. Arrhythmia can also be related to a deficiency of vitamins and minerals, particularly potassium and magnesium. This can happen, for example, if you've been nervous and your magnesium levels have become depleted as a result. Potassium magnesium deficiency can be related, for example, do you know what with? If you've had food poisoning, for instance, with vomiting and frequent diarrhea, we lose a lot of electrolytes, magnesium and potassium through our stool. That's exactly why there are special rehydration solutions and similar products. Or at the very least, you should drink medicinal mineral water during diarrhea to replenish what's lost. These very electrolytes are extremely important. It is a startling fact that you can even experience a severe heart rhythm disturbance literally just from having diarrhea several times a day. If you find yourself going to the bathroom 5 or 6 times in a single day, you might actually develop a dangerous arrhythmia. This happens because your body suffers from a rapid depletion of vital vitamins, essential minerals, and critical electrolytes like potassium and magnesium, which are necessary for your heart to maintain a steady and healthy beat. Minerals. Or with sweat, you crave something salty and you're losing a lot of electrolytes that your heart needs to function properly. That's why, when working in the heat or spending a long time in hot conditions, if you're sweating heavily, it's essential to replenish electrolytes, either with mineral water, preferably medicinal since it has a higher concentration of electrolytes, or with special electrolyte mixtures or solutions to avoid developing a deficiency. So, these are some of the possible causes. And accordingly, as soon as you take in minerals, they are absorbed quite well, and your arrhythmia goes away. You rest, drink water rich in electrolytes, and everything will be fine. Dizziness, darkening of vision. So, again, this could be related to heart failure or arrhythmia, but you will also experience other symptoms. Alternatively, dizziness and blurred vision can often be associated with anemia as well. Or it could be due to problems in the cervical spine. When veins are compressed, blood outflow from the head is disrupted, and venous congestion occurs in the head. This can cause a feeling of heaviness, headaches, dizziness, and even some visual disturbances. So, in this case, a manual therapist, osteopath, or a specialist like a massage therapist who can relieve muscle spasms will help us. They will restore normal outflow, primarily the venous blood outflow from the head, and these symptoms will go away. The heaviness in the head and this whole situation. Why am I specifically talking about outflow? Because the inflow of blood to the head, specifically arterial blood that comes through the carotid arteries, is rarely disrupted and usually only in old age. In other words, for the inflow to be disrupted, there would have to be large plaques in almost all the major vessels. The carotid arteries, which carry blood to the head. The fact is, the brain is vital for the body. And even if one carotid artery is blocked, there are a huge number of collaterals, that is, alternative pathways for supplying blood to the brain. So, in order to actually feel unwell due to impaired blood inflow, the disruption would have to be very serious, a severe disruption. But the outflow of blood through the veins is very gentle and delicate. They are very easily compressed, even by muscle tension. And because we so often, modern people are always on their gadgets, meaning they're often in a hunched position, right? Basically, people tend to slouch. Everyone is looking down like this, so there's constant tension in the trapezius muscles and the muscles at the back of the neck. And this muscle tension compresses the veins that carry blood from the head. And that's how you get venous congestion. So, here, for example, either self massage, by the way, works great, or the Kuznetsov applicator, which improves microcirculation here and stimulates biologically active points, helping to relax. This is muscle tension. There are different techniques. This video isn't about that, but in general, pain in the muscles at the back of the neck, combined with dizziness and darkening of vision, can be related to impaired blood outflow. Chest pain, tightness in the chest. Here, it's very important to understand when this happens. If it happens out of the blue, so you're just sitting there and suddenly you feel a stab, a sting, or a sharp pain. So, what could this be related to? It could be a rhythm disturbance, or for example, you bend over and suddenly feel a sharp pain. This could be due to either a rhythm disturbance or you might have developed intercostal neuralgia. In other words, the stabbing pain is connected to a nerve that runs between the ribs, and so you experience a similar effect, a pain somewhere inside, somewhere in the heart area. But if these pains, tightness, and tingling occur during physical activity and stop when you stop the activity, you need to see a doctor that same day. So, if you are walking, climbing stairs, going uphill, or moving faster, and you feel a stabbing pain in your heart, then you stop, catch your breath for a bit, and the pain goes away. But as soon as you start walking again, the pain returns. Urgently, you need to see a cardiologist that very same day because this is a symptom. It could really indicate some kind of cardiac emergency. If these tingling sensations occur while you are at rest, or if you just twist a little and feel a prick in your heart, it could simply be neuralgia related to stress, cardioneuralgia, and may not be connected to the heart itself. These are some examples. Please write in the comments if you have any questions about the heart, if you experience any symptoms that are unclear to you and you want to figure out which specialist you should see. Please leave your comments under this video. I will be happy to go over these symptoms with you. But if you have doubts, if you feel that it might be your heart after all, as a cardiologist, I say, it's better to be safe. It's really better to make an extra appointment with a cardiologist and get an ECG done. If necessary, do additional tests like a heart ultrasound or a Holter monitor, which is a 24-hour ultrasound monitoring. If you have blood pressure spikes at unclear times, at night, during the day, or in the morning, then do a 24-hour blood pressure monitoring. In other words, observe all these changes and select the right therapy if needed. Heart diseases can lead to serious consequences. When we rule out heart problems, it becomes much easier to figure out the cause elsewhere. At the very least, we have time for this, and we can calmly continue with further examinations. Replenishing vitamin deficiencies, correcting MI, relaxing the neck muscles, and so on. I wish you good health, and I hope that you only feel your heart when you are in love.